So what kind of a doctor do you need to go see if you think you have pelvic floor dysfunction? That's the subject of this video, and it's a very important one for everyone with pelvic floor dysfunction to pay attention to. Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy, and stay tuned. All right, so one of the things that happens is pretty much people think pelvic floor dysfunction and incontinence are the same, and the answer is not necessarily. And then they think, well, I don't know if I have pelvic floor dysfunction. Who do I need to go see? Do I need to go see a urologist? Do I need to see a gynecologist? Do I need to see a urogynecologist? Do I need to see my primary care doctor, a neurologist? I mean, there's like, who do I go to see? In reality, when it comes to pelvic floor dysfunction, and I'm, by the way, none of those doctors. So in my practice, and I think that's probably the right person, because when you go to a urologist, they're looking at your basically urinary tract. When you go to a gynecologist, if you're a female, obviously, they're looking at the gynecological aspect of down there, down below. But you may be going to a urologist because you're a male, or you may be going to a urologist because you're a female with those issues. There are so many different factors, so many different things that can contribute to the dysfunction. Unfortunately, we're seeing more and more dysfunction in much younger people, and I wish people would understand what to look for so they can address the problem sooner before they become drastic cases. So when we're looking for dysfunction, the general cue for you should be if you're having ongoing doesn't mean constant. It could be a comes and goes. Issues with your hips, with your lower ab weakness, with your sacroiliac joint in your pelvis, with your lower back, lower mid back. If you're having a poor posture, you automatically are at risk. So the best thing to do is to not deal with the pain here, because frankly, they design medication for pain that does nothing for the dysfunction. So you gotta be smarter than what you're being presented. So the thing you wanna do is to improve the movement, you wanna improve the posture, you wanna improve the strength behind your muscles, not in isolation, but that those body parts know their role, their synchronicity in movement, the progression, their role in the progression of movement. So as you're going about living your life, moving around, all those sequence of things are happening in the right order. Therefore, there is a function behind your movement. So in order to do that, that's what prevention is. In order to do that, you need to go see a doctor that specializes in movement. So then what kind of doctor it is? That's a good one. You gotta do a search to see what kind of a doctor does all of those. In our practice, we do that. This is a chiropractic office, but our specialty is neurology, postural neurology, neurokinesiology, the developmental movement, and pelvic floor dysfunction. So in our practice, we do all of that. We assess for all of that. For parts of the care, we may refer out, but most of the times we don't have to. Hope this answered your question. You don't want to be lost looking for the right provider or where to go, and just the title of a specialist does not necessarily qualify them for the proper treatment. If you enjoyed what you saw here, please make sure you subscribe to the channel. If you have any questions, use one of the methods of contact in the description box to contact us. And until next time, take care.